Welcome everyone to another health-related social needs training module. Today's session will focus on real-life examples of workflows from enrolled HRSN service providers. My name's Claire Londigan. I use she, her pronouns, and I'm a health policy manager with the Oregon Rural Practice-Based Research Network. We're collaborating with OHA to provide technical assistance to HRSN service providers. We've heard that service providers are interested in seeing examples of successful intra-organizational workflows of incorporating HRSN services into existing systems. We've continued to see this interest reflected in registration and evaluation surveys. Today's session will highlight actual workflows from 3 enrolled HRSN service providers focusing on housing services, although we hope some of the material will be helpful for other service provider types. So these 3 service providers will share their approach, the visual workflows, and as relevant, resources for tracking outreach and engagement activities, connecting with external parties like landlords or utility companies, and intra-organizational personnel responsibility for different steps of closing the loop from service request to invoicing. By the end of this training module, we hope that you will understand how other community organizations have incorporated HRSN services into their systems and identify examples that you may be able to adopt as you build systems to provide HRSN services. So let's walk through today's agenda. We'll start with some background where we will review HRSN services and the differences between open card and CCOs, or Coordinated Care Organizations. Then we will hear from Laurel Hill Center, Northwest Family Services, and Plaza de Nuestra Comunidad about their internal workflows for providing services like rental assistance, utility supports, and tenancy services, as well as outreach and engagement. To wrap up, we will share additional resources. First, a little background. Health-related social needs, or HRSN benefits, include housing, nutrition, and outreach and engagement services for eligible Oregon Health Plan members. HRSN service providers can provide services for one or more of the benefits I just listed by contracting with a local coordinated care organization or through the Oregon Health Authority for open card or fee-for-service members. To learn more about becoming a CCO provider, please access the link from the slide deck located on the HRSN Provider Training webpage. To learn more about becoming an open card provider, visit the Provider Enrollment webpage or watch the enrollment training. Today, we'll share examples of workflows from HRSN service providers enrolled with open card and CCOs. In terms of case management and systems within your organization, these are some key pieces of information to know before we dive into the examples from service providers. For open card, also known as fee-for-service, Oregon Health Authority contracts directly with service providers throughout the state and partners with IN for all invoicing and payment to providers. IN is where open card providers submit invoices for payment, and IN verifies claims and submits to OHA through the Medicaid Management Information System, or MMIS. Oregon Health Authority works with Accentra to authorize services, receive service requests, and send referrals to contracted service providers. Accentra supports care coordination end-to-end, from OHA service providers to IN. Accentra enables a closed-loop referral process for open card OHP members. You can expect all open card communications, processes for referrals, and requirements for invoicing to be consistent across the state, no matter what region you work in. In contrast, coordinated care organizations decide what service providers in their region to contract with. HRSN service providers must contract with a CCO to be paid for services provided to members of that CCO. You can contact the CCOs in your area to learn how to apply to become a provider for each CCO. CCOs are responsible for authorizing services and confirming eligibility for OHP members enrolled in their managed care plan. They have unique workflows and software for authorizing services, receiving service requests, sending referrals, and invoicing. CCOs may use a community information exchange platform like Unite Us or Find Help to share HRSN information among partners. The workflows that you see today may be different than the workflows that a CCO you work with uses, or even may be different than the workflow for a different service type with that same CCO. We hope that elements of these service providers' processes will give you a model to adopt or adapt, but we acknowledge that these workflows in their entirety are not relevant to every organization. Take what is useful for you and leave the rest. Now let's dive into the examples from our 3 service providers. First, we'll hear from Emily Yates, a housing services coordinator from Laurel Hill Center in Eugene.
Hi, my name is Emily Yates. I use she, her pronouns, and I am the Housing Services Coordinator at Laurel Hill Center. I've been with Laurel Hill Center since November of 2024, so I came on right as we started doing HRSN services. We're doing HRSN housing and outreach and engagement services with all of the OHP providers in Lane County. So that includes Trillium CCO, Pacific Source CCO, and we're working with OHA Open Card. So we help eligible OHP members with rent assistance, but also that includes gathering the information to see if they're eligible for rent assistance. And we have 3 staff who work part-time on HRSN while balancing other responsibilities, and we have 1 full-time HRSN staff. Outside of HRSN services, our agency offers a lot of various mental health services. We offer supportive housing, including rent assistance programs, and we have some housing that we own. And then we offer employment and education programs. So we kind of have a lot of comprehensive services. We offer peer support services, case management, medication management, all sorts of things. We have a wide variety of services at Laurel Hill Center. So we receive our referrals from CCOs via Unite Us, and then we have an internal spreadsheet that we use to track all of the information that comes in. So we assign a case manager to folks and then track the progress of their services through that spreadsheet. Each line is a unique member, and then in that line we gather information such as the date of the referral, the household size, their income, their months owed of rent, the amount of each month's rent, their current needs, just to kind of track what's going on with folks. And then we also work to see what other funding is available to people. So we try to keep track of what emergency rent assistance is available from different places throughout our county, if they need support beyond the 6 months of HRSN rent assistance, or if they don't qualify and need to look at other rental assistance options. We also have long-term rental assistance programs that we have at Laurel Hill Center that currently support about 100 people. And while we don't necessarily move people from HRSN to those programs, it does help us build relationships with landlords and have different relationships in the community that we found really advantageous through this process. So when we get a referral from CCO, from the CCOs, it comes a little differently depending on which one. So from Trillium, we get them directly to us, but from Pacific Source, they group them to a couple different agencies. So theirs go all into a queue, and then people pull them out as they're able, which is nice because I don't think people necessarily get served faster, but there's always people available when you are ready. And then from Open Card folks, we get them through Essentra. So when we get referrals in, I, as the housing services coordinator, take those referrals and I assign them out to my staff. So each new member goes onto the tracking sheet and are assigned to one of the housing team staff. I do that every Monday. I send new HRSN participants out to people for them to work with and start gathering information with that week. We work to connect with the member. We try to contact them at least 3 times, 2 different ways. So that could look like phone calls or text or a scripted email, on occasion a letter if we need to. We track that on our spreadsheet as well, when those contact attempts were made and how that contact attempt was made. We weren't always tracking that as closely, but we found that with the volume that we're bringing in, it helps to track that information. And then if needed, we connect the member with an interpreter or refer them to other HRSN providers. We don't have a Spanish-speaking HRSN provider, but other agencies in our county do. So if we have a Spanish-speaking member, we try to connect them with that agency so that they can get culturally competent services. If we can't, we do have interpreters we work with, and we have a lot of our documentation translated as well. When we first talk to people, we try to assess the severity of the situation. It doesn't change how we serve people, but if they're facing eviction, we really want to know that so we know if we're up against a deadline. It helps to know, and we've had landlords who are pretty willing to work with us when we're able to explain the process and where we're at in it. So we have the participants sign a release of information, and then we connect with the landlord, tell them that we're working on processing this case. If we need to, we connect with the utility company or anyone else we might need to gather documentation from. Typically, we get income information from the member. We get a lease either from the member or the landlord, and then there's some other things. We need a W-9 from the landlord. And if they have past due rent, we try to get a ledger from the landlord to just make clear what we should be paying. So once we get all of that information in, we complete the eligibility screening questionnaire with in Unitas with the member. We work to document all the member information on our internal tracking spreadsheet, just so that we've got it all down. We know we're getting everything that we need. And we separate that spreadsheet by where folks are at in the process. So we have a tab for folks who are enrolled, which means that we've taken the referral and we're gathering information. We have a tab for folks who are currently receiving assistance. We have a tab for this person's closed, and then we have archive tabs where we put information we gathered in the other tabs. So we try to really keep track of everything, and not just, lose people in the process of this, which when there's a lot of referrals would be easy to do. And then case managers track their time throughout the week, and they invoice at least weekly for all of their activities. So as we get all of their information in, the next thing we do is open their housing case. So for CCO members, after gathering relevant documentation and information, we submit the request for their case in Unitas to the CCO. And then once that service is authorized, the case manager puts in a check request, which I sign. I move the folks, if they're new, into the right spreadsheet or tab on the spreadsheet. And then we submit the check to our finance team. Our finance team writes the check, and then they send directly to the landlord, utility company, or other relevant third party, unless we're up against a deadline. And then often the case manager will take the check to the landlord directly. That often happens with rent that's past due. Our finance team does all of the invoicing for the direct services, where our case managers do it for their time. And then at that point, we reach out to the member with an update. So to let them know where we're at in the process, we've put the check request in, your landlord should be receiving it soon. We've also started sending out a letter at that point to the member that really lays out what that 6-month time frame is. We found that it can get a little confusing, particularly when they have past due rent. And so sending a letter out that really clearly maps it out is helpful at that point. So the staff invoice for their time throughout the week, and then they check in with the member as needed. And so they try to keep in touch. Members are often sending bills pretty regularly for different utilities. But then at 3 months, we send a letter out to the member explaining that they're halfway through the benefit and that we're here to help them in any way we can. We find that the 6-month time frame, when it starts, people think it's a long time, and so they aren't as engaged because they think, oh, I don't need to worry about this for a little while. But once we reach that 3-month point, we really try to remind them that we're here to help them plan for whatever's next so that they're stable when they stop receiving HRSN assistance. And then when they hit the 6th month, we send them a letter to let them know that it's their last month receiving assistance. So we get the referrals in, as we talked about, from the various sources. We connect with the member. Sometimes that involves a little more help with an interpreter. We connect to all of the eligibility screening. So we gather the information to see if they're eligible and then do the questionnaire. And then we send the request to the health plan. Once we get approval to open the housing case, we do that and put in the check request for accounting to cut a check. And then we just keep turning check requests in, and the finance team manages getting us checks for all the rent and utilities and then entering those invoices into Unitas. And while we're doing that, the case managers, they manage just the ongoing relationship with the member. So they help as needed. They put in that 3-month member check-in letter, and then they do the 6-month closeout. So their goal is to try to engage people and provide as much support as they can through this process. So that's what this looks like at Laurel Hill Center. And now I'll hand it over to the next organization to go over their workflow.
Thanks so much, Emily. Now we'll hear from Samantha Ferris with Northwest Family Services.
Hi there, my name is Samantha Ferris. I am the HRSN program manager at Northwest Family Services. I have worked at Northwest Family Services for about 10 years now, and I use she, her pronouns. Northwest Family Services is excited to provide HRSN services to our community. We are enrolled as an HRSN housing and outreach and engagement service provider, and we are providing services to the CCO called HealthShare. We help members in Clackamas County with HRSN tenancy services, rent assistance, utility payments, sometimes storage fees, as well as O&E services. We have 6 full-time case managers that are working on this HRSN project. We have 1 full-time employee that is focused entirely on billing. We have another full-time employee that is focused on accounts payable. And then we also have a program manager to help this program run efficiently. Outside of HRSN, we do quite a few different things to support our community. I think we have around 36 different programs. Each of these programs fall into one of the following categories. These are basic needs supports such as climate, nutrition, and taxes. We have behavioral health services. We provide support with health and system navigation, and then we also have youth empowerment resources. Northwest Family Services is using a few different programs in order to complete our HRSN tasks and in order to track our work and maintain our needed records. So first of all, we use Unitas. This houses our member referrals, and it is how we not only just receive referrals, but also how we receive the supporting documentation that has been gathered for a participant prior to them being sent to us. So as they go through the application and approval process for HRSN, their different documents are being gathered, and that's how it gets sent to us, and we're able to also send our invoices that way as well. Internally, we use Microsoft Teams, and not only do we use it to chat and have discussions with each other and share documents, but we also use an app called Approvals in order to complete purchase requests. We have chosen to use this app because it allows us to build it in such a way that we can add in all of the needed information that each of the different staff members may need in order to complete their tasks connected with HRSN. We, of course, are keeping case notes and documentation of communication, not just with our participants, but also with external parties. And we have been using OneNote in order to capture that. We are currently exploring other case management systems. We understand that it might be easier to use a system that is made for case management so that we aren't having to create our templates on our own with OneNote, but that is what we're currently doing. Another piece is that because we have various other programs, we're really passionate about trying to help participants any way that we can. And so sometimes we will find ways that we can refer a participant to another program or another funding. Maybe they needed a little bit more support outside of what HRSN was able to do. One example is we have a short-term rent funding available, and we have used this in special cases in order to prevent members from eviction. And we're really excited every time that we're able to do that. So I'm going to take you through our workflow just a little bit. It starts by receiving a referral. We receive a referral on the Unite Us app. The program manager receives an alert saying you have a new housing referral. This referral comes to us, like I said, on the Unite Us app, but it is coming from HealthShare of Oregon, and it's sent directly from HealthShare. We also do have some people that are doing what we refer to as a self-referral or an internal referral. And so this is when we are maybe needing an additional benefit that wasn't on the original referral. We have a process through Unite Us that will go through in order to create that new referral. We also sometimes have participants that could benefit from a little bit of a different support, maybe through their CCO, and so we will help them with that as well. Finally, participants that work in that participate in non-HRSN programs that we think would qualify for HRSN, we also help them apply for that as well. And so we consider that O&E, and we will, our non-HRSN caseworkers fill out an internal referral that we made for HRSN specifically, gathering all the information that the HRSN caseworker may need. And then the non-HRSN caseworker will send it to an HRSN caseworker, and they can create that referral as well. Next is connecting with a member. So once we get a referral assigned to us from Unite Us, the first thing we're going to do is we're going to look and see what language the participant speaks. This is so we can make sure that the participant is getting to a caseworker that is fluent in their language. Of our 6 caseworkers, 2 are English only, and 4 are both English and Spanish. So we have the ability to support participants in the language that they're most comfortable with. Next, we connect with the member and we just evaluate their needs. We call them, we introduce ourselves, we talk a little bit about the program, we answer any questions they may have. We often have an idea of what they are needing, whether that's tenancy support or rent or utilities, maybe a storage unit. Maybe as we're talking to them, we're finding out other things they need. Maybe they were sent to us for rent and utility support, but we also learned that they need some tenancy support in navigating conversations with their landlord or something like that. So we're just taking that time to connect, understand the situation, and make what would be really considered a basic case plan. So then the caseworker confirms the member's request, and then we go on to a program called MMIS in order to verify their OHP eligibility. And MMIS only shows for the current month. So we actually have to reconfirm that their OHP remains eligible every single month. And if they are nearing the deadline or the time for re-enrollment, we're able to support the participant in getting that done so that they don't lose their health benefits. We also, one of our non-HRSN programs is a OHP enroller. And so we have a specific program with 3 staff that we can partner with to help our participants maintain on their OHP benefit. So then we have what's considered an open housing case. The managers accepted the referral, they've assigned it to a caseworker. The file is then reviewed for application documents. We reach out to the client and then often to the landlord to establish the program guidelines and expectations. We want everyone to be aware of how long they will be working with us, what their specific situation is, and often there may be some extra documents that maybe we need to gather or something like that. And so we take the time to make sure all of that is ironed out. Once we have all the documents we need, we know what is approved, we know that they qualify, we have all of our boxes checked, I guess we can say. Our caseworker is going to submit an internal purchase request for the finance department. And again, we do this on an app on Teams, and that app is called Approvals. And so we go through, we fill out all the information that our finance team may need. We also include on there the information that our billing specialist needs in order to complete her invoicing later on. And we're able to add attachments, so everything is stored together very easily. Next, the finance team pays the landlord, and then they submit that invoice through Unitas. The only thing that might be added to that step is there may be some times where we need to navigate whether we're delivering the check or mailing the check. And so this is, again, part of that conversation that's happening when that caseworker is reaching out to the landlord. We're finding out, is the landlord willing to accept a promissory note, or do they need us to deliver that check as soon as it's written in order to prevent eviction? And so we work to navigate all of those steps as well. Finally, we offer this ongoing case management. So the finance team manages invoicing. Once we have gone through the first month, it becomes a little bit more routine. We have an established relationship with the landlord and with the participant. And so we often aren't having to spend as much time trying to establish what the protocol is or what it is that the landlord expects in terms of payment and how they're going to receive it. We often have the paperwork and documentation required in order to make those purchase requests. Our caseworker continues to maintain contact with the member, and then they track their services through internal notes that we keep on OneNote currently. However, there is some information that maybe is on Teams or email as well, but we do try to capture it all in OneNote so that it's simple to understand and to follow. Check-ins are at the very least once per month. However, I don't think there's been anyone that has only checked in once per month because naturally communication is happening more. Participants often have questions. Maybe there has been a change in something. Maybe they are receiving their next month's utility bill and they're sending it to us. Some of our participants maybe are forgetting to contact us, and so then we're naturally going to contact them. We try to do it no later than the middle of the month so that we have time to make our purchase requests, have our finance team do their work and cut those checks and mail them out before it's too late. And then our case managers track their time and they invoice for O&E and tenancy. Our case managers complete the invoicing and submit it themselves on Unitas. However, when we have a non-HRSN case manager doing some work for O&E, and so this is happening when we're like referring a client, then we have the HRSN billing specialist complete that invoice. And again, we use Teams and that approval app. We've just created what we call a purchase request, but it's not really we're not purchasing anything in this case. We're just tracking our O&E time. The reason why we use that approvals app is because you can assign who in a chain of staff is going to receive an alert or need to provide an approval for each thing up the line. And so this makes it simple that we can just assign which of these purchase requests or which of these forms need to be delivered to which staff. So this is a picture of our workflow for those of us that like that visual. So we're going to start at that top left. HealthShare is going to provide us their clients, and they're going to send them to us through Unitas. And then we also have self-referrals that are they are existing members of HealthShare, and then they are also most often participants in one of our different programs. And so those are the two ways that we receive referrals. However, the self-referrals are only for they're only for the application and getting on that waiting list of HealthShare. So we receive that referral, and then we are going to assign that to a caseworker. And again, we are going to do that dependent on language. So that's the first thing we're looking at when we are looking at a new referral is what is that language spoken? And then if it's whether it's English or Spanish, that will change who we assign it to. And then that caseworker connects with the member. They give them a call. They review the documents that we have. Maybe they ask for more documents. We figure out if what has been listed in the referral is accurate from the participant's perspective, and we try to make sense of these different pieces. And then we will ultimately contact the landlord, contact the utility providers, whoever it is, figure out how payments can be made. And then we're going to initiate our internal purchase request process. So then we have what is considered an open housing case. They can be open for up to 6 months. However, it may change depending on the arrears. It may be a shorter amount of time that they're open. Then we provide some ongoing case management. So our member information is managed via internal communications and stored in internal tracker. Internally to communicate, we utilize email, we utilize Teams, and then for our own for each individual caseworker's notes, they use OneNote. And we are in process of connecting with a case management system. Throughout that time, that period of ongoing case management, that caseworker maintains with the contact with the member during what is typically a 6-month referral. And that caseworker not only is maintaining contact, they're also continuing to make monthly purchase requests to our finance team in order to keep their utilities paid, keep their rent paid, and get them set up. Something that we're often trying to do as we're working with members is trying to figure out if there is another program that we know of that could be a benefit to them. And the only way to get that information is to speak with them, connect with them, and learn about their individual situations. I think that this is about as brief of an overview as I can give with NWFS's participation in the HRSN program. I'm grateful for your time, and I'm going to hand it over to our next community partner. Thank you.
Thanks so much for putting that together and sharing, Samantha. So lastly, we'll see the workflow and processes that Plaza de Nuestra Comunidad has developed and hear from Pablo Sierra. Take it away, Pablo.
Hello, my name is Pablo Sierra, and I'm with Plaza de Nuestra Comunidad. My pronouns are he, him, él. I have been working with our organization for the last 4 years to serve the Latinx community in Lane County. I am very excited to share how we support our community members through the HRSN program. Plaza de Nuestra Comunidad serves as an HRSN housing and outreach and engagement provider working with a Pacific Source. Our primary focus is helping Latinx members in Lane County with rent and utility assistance services to prevent eviction and homelessness. What makes our approach unique is that we have one dedicated staff member who manages the entire case management process from accepting referrals all the way through sending invoices. This streamlined approach allows us to provide personalized, culturally responsive service to our community members. Beyond our HRSN work, Plaza de Nuestra Comunidad offers a comprehensive range of services, including our social services program where we help with health insurance navigation, the SNAP food assistance applications, and additional rent assistance. We also provide mental health and recovery services, support community gardening initiatives, offer small business development programs, and run educational and youth development activities. This, this holistic approach means we can address multiple needs for the families we serve. For case tracking, we used several integrated systems. We receive 5 to 10 referrals per month through Unitas, track our members using QuickBase and as our primary case management tool, and maintain an internal spreadsheet, a system that allows our staff to share notes and coordinate services effectively. We leverage various funding sources for rent and utility assistance, drawing from federal, state, and county programs to ensure we can meet diverse needs. Our agency also maintains an active referral network through community partners, which help us connect members to resources beyond what we can directly provide. Now I would like to walk you through our specific workflow process we have designed to be both efficient and member-centered. We received referrals from Pacific Source through the Unitas platform. When a referral comes in, our case manager immediately analyzes the case to determine whether we have the capacity and resources to support that individual effectively. If we cannot provide the appropriate level of service, we refer that person to another agency that can better meet their needs. Once we accept a referral, our case worker contacts the member directly. During this initial contact, we review their application documents together, discuss the HRSN program's eligibility requirements in detail, and make sure they understand the program restrictions and timelines. This conversation is crucial because it sets clear expectations and helps build the trust that's essential for successful case management. When collecting necessary information, we work with the member to gather all required documentation, which typically includes pay stubs, utility bills, other financial documents. All of these documents are uploaded to Unitas so that the CCO has complete access to the case information. This documentation process ensures transparency and helps expedites approvals. When opening housing cases, we create a case for either rental assistance or utility assistance, depending on the member's specific needs. An important part of this step is contacting the landlord directly to obtain the rental agreement. Once we have all necessary documentation, the CCO reviews and approves the case, which then approves the contracted services for rent and utilities. After the CCO approves the case, this case is sent to our fiscal department for invoicing, then forwarded to the CCO for final review and acceptance. Once everything is approved, we send the check directly to the landlord, ensuring that the member's housing situation is stabilized quickly. In terms of ongoing case management, our support doesn't end once the initial payment is made. We maintain regular contact with the members and inform them that assistance remains available for up to 6 months. This ongoing relationship allows us to address new challenges as they arise and provide continued stability. An important administrative step is sending a promissory note to the landlord once the invoice is accepted by the CCO. This helps maintain good relationships with landlords and ensures clear communication about the payment processes. Throughout this entire process, we manage member information across multiple platforms to ensure comprehensive tracking. As I mentioned before, we use our internal spreadsheet for staff coordination, QuickBase for detailed case management, and Unitas for CCO communication and documentation. What I want to emphasize is how our workflow prioritizes both efficiency and cultural responsiveness. Having one staff member manage the entire process means members have a consistent point of contact who understands their situation and can navigate them through each step. Our 6-month support window provides a meaningful stability, not just a one-time intervention. Our integration with multiple tracking systems ensures nothing falls through the cracks, while our community partnerships mean we can address needs that go beyond housing systems. This comprehensive approach recognizes the housing stability often connects to other social determinants of health. Our workflow at Plaza Nuestra Comunidad demonstrates how thoughtful case management combined with strong community partnerships and cultural competency can effectively address housing instability in the Latinx community. We have found that this approach not only prevents evictions but also builds long-term community resilience. And with that, I will hand it over to Claire Lundigan. Thank you.
Thanks so much, Pablo. A huge thank you to all the organizations that shared today. We really appreciate the time that you took to educate us on your processes and your willingness to support moving this work forward. Before we wrap up, I will share some resources and upcoming opportunities for you all. So this slide includes a few links to learn how to get started on the enrollment process for fee-for-service and how to connect with coordinated care organizations who are managing the contracting processes within their region. There are also some helpful Oregon Health Authority HRSN related resources that may support you as you continue this work. One of them being the HRSN Provider Journey, which is a resource for providers that has recently been updated. As far as next steps and upcoming opportunities, there are monthly office hours through the end of 2025. So from now through December, there will be monthly office hours with Oregon Health Authority. Registration information will be emailed out and posted to the HRSN provider training webpage, so you can find it there. Also, if you're interested in viewing any of the previous HRSN provider trainings, they are available on that same HRSN provider training webpage. We value your feedback to help improve future trainings for HRSN service providers and would really appreciate if you would take a few minutes to fill out this 5-question survey. You can hold a smartphone up to capture this QR code or copy the text from these links into your browser. Thank you again for tuning in today.